Alarming allegations, sexual assault, filthy conditions, and dangerous understaffing, all at a mental health hospital north of Denver.
Prisons are offering better care than Johnstown Heights.
Denver 7 investigates, exposing more concerns from veteran nurses.
Everything about that place is wrong. Just want somebody to do something about it.
Tonight, they're calling on state regulators to step in.
Chief investigative reporter Tony Kovaleski breaking down the details for us.
I have never, ever seen a place like this.
He's a veteran nurse. He spent 6 weeks inside this hospital, hoping to help.
It's not acceptable. It's not right. There's a lot of people, a lot of good people can get hurt. And I don't think making money is worth it.
What was the priority at Johnstown Heights?
Money. They're prioritizing money over patient care.
She is also a veteran nurse.
It's dangerous for staff. It's dangerous for the other patients.
She spent more than 6 months working inside the 92-bed mental health hospital. Because she fears speaking out could prevent her from getting a job, she asked us to disguise her identity.
There's a problem, a big problem, and that it's not being addressed.
What made you decide to reach out to our team?
In 40 years of nursing, I have never seen a facility like this. And if something isn't done to change the way that facility is managed, people are going to get hurt, staff, patients could die.
Both admitting during lengthy interviews that the staffing shortages, increased dangers, and a failure by senior leadership to prioritize patient care all contributed to their decisions to resign.
You know, they're being warehoused. They're being kept there longer than they need to be because they want the heads in beds. They want the facility filled. They want the insurance money.
I saw a lot of scared people there. Sexual assaults happened about once a week. Assaults happened about once a week or once every other day. I was assaulted while I was there. It's a mess.
And both nurses reached out last month after hearing our initial report, where patients and mental health techs raised serious concerns.
What they're doing is not right. We shouldn't be held there longer than we need to be.
It's just not right. It's taking advantage of everybody.
From what you've witnessed, what concerns you the most?
The length of stay for people. I don't think that people should be held as long as they do without seeing a doctor or a psychiatrist or anybody.
You saw the facts we reported. From your experience, were they accurate?
Yes, absolutely.
I thought your reporting was spot on. The patients were not being seen by the doctor. They were not going to group sessions. They were not going to counseling. They were not getting care other than multiple medications. They were just being housed.
The docs would come in and write orders for medications for patients that they had never spoken to, had never seen. They would change medications for patients that they've never treated, cared for, spoken to.
After learning of Denver 7's investigation, the state's Department of Health announced that it was launching its own investigation into Johnstown Heights. Do you think state regulators have any idea the truth behind the doors of Johnstown Heights?
No, I never saw housekeeping in 6 weeks. So the rooms just stayed filthy and nasty. You open the rooms and the odor is horrendous. Urine or whatever else was on the floors. And when one patient got discharged, they just changed the sheet and another patient took its place.
Both nurses also questioned the integrity of inspections by the state.
Whenever they had state come in, they would staff up. They'd call people in and say, you know, it's all hands on deck. Everybody's got to be here. So it appeared to the state that they were fully staffed.
What's the truth?
They were not. Nowhere near.
In the end, courageous testimonials from 2 veteran nurses now hoping to force state regulators to dig deeper. Is this a wake-up call to the leadership at Johnstown Heights?
If they haven't had a wake-up call by now, I don't know what would wake them up. If they don't make changes now, this is greed to the top.
Both nurses told us they raised their issues with senior leaders before they resigned, And back in October, we did meet with Johnstown Heights CEO Sean Peterson as he arrived for work. We wanted to make him aware of the serious concerns raised by patients and members of his staff. He took our business card and promised to call. That was 6 weeks ago. We've made other calls and still no call back. Finally, we will follow up on the state's ongoing investigation. I'm Chief Investigative Reporter Tony Kovaleski.
Tony, the Denver 7 Investigates team have reported extensively on problems at Johnstown Health, and you can find all the coverage right now on the Denver 7 Plus app for streaming devices.